Welcome to Get Moving TV. I'm Dr. Chris Landon and serve as your host. I've been here in the County of Ventura over 25 years. It's been a great place to partner. The Ventura County Board of Supervisors has supported our hospital, has supported the development of an incredible healthcare system. We work very hard on making certain that no money, no mission. And if we can't find money for healthcare, that's going to be a problem. But really we want to find money for healthcare, not sick care. We don't want sick people. We need to get a step ahead of all that's going on. I think one of the biggest things that's come out of this Affordable Care Act is a lot more of our patients do have access to care. But what we really want to concentrate on is that hospital discharge doesn't end when you walk out the doors. We need people to have primary care physicians. We need people to, for the next 30 days, to have enough attention paid to them by nurse case managers so that they don't return to the hospital. The hospital is an expensive place. And when you're there, you're surrounded by a bunch of sick people. We want health. We want you to feel healthy. We want you to be active. We want you to be eating right. So as we look at the county, we look for funding sources outside of this so that we can bring in these health care services. And sometimes we have to try innovative things. Some things are going to fail. Not everything's going to work every single time. So with me today is Dr. Renee Higgins, Chief Operating Officer for our healthcare agency. Welcome to Get Moving TV.
Thank you. Happy to be here.
So I'm always looking for my replacement wing here. So we're building a replacement wing for the hospital. And I'm always looking for somebody who starts to get it, who starts to understand that we're looking for a future and that we have to reach for these kinds of things outside. So it's been good to watch this come. So what's a healthcare problem you're working on? Or tell us more about what a chief operating officer does.
Well, personally, I oversee what we term the campus clinics, the ambulatory care department. And that covers the clinics, the outpatient clinics located on the hospital campus, as well as the healthcare for the homeless, as well as I also oversee the healthcare for the employee health services.
Well, that's a lot of responsibility. It's a lot of people to interact with. What are some of the services? I'm very proud of our ambulatory healthcare system. I know our family medicine residency, something, they get recognized for something?
Yes, they did. They were recognized to be the #1 family residency program in the nation.
Yeah, so U.S. News and World Report, Doximity, which is doctors having opinions about doctors, there they are #1. And so to serve that residency, to serve that education, we fill that building with people with a heart, with compassion, but also with a large fund of medical expertise. So what's on the different floors?
Well, on the top floor, it's a 5-story building.
Mm-hmm.
On the top floor, we have the hematology oncology department and the immunology department. And we also have infusion for 2 infusion rooms for chemo and non-chemo infusions. And we also have the Anacapa Surgical on the 4th floor, and also Medicine Specialty West, where we can cover many different specialties. And on the 3rd floor, we have yourself, Pediatric Diagnostic Center, and we also have the Pediatric Oncology Department. And on the 2nd floor, we have the Academic Family Medicine Clinic, and on the 1st floor, we have room for the residents. That's their department. And also the auditorium, it's the instructional area for the residents. And we also have our urgent care clinic. And we also have, in the hospital, 2 clinics. We have our cardiology clinic and our orthopedic clinic.
Well, I'm really quite proud of that building. And when I came in 1989, they were going to build a 5-room clinic for me behind the hospital. And in 2010, we finally moved into the clinic that I designed in 1995. Took a while, but we're there. Well, and the array of specialties is incredible. I mean, the infusion is now not just chemotherapy drugs. There's all these mouse antibodies against rheumatoid arthritis and lupus and It's quite a
Right.
quite a value to our community. Our surgeons, we have really top flight neurosurgeons. We have a trauma program, so that the kinds of things that we take care of are really at the limit of life. And then we have a bariatric surgery program as well, which is really on its way to accreditation in this county. It takes a certain number of cases, and it's really serving that safety net, but it's serving everybody, which is remarkable. Third floor, I've got my specialists coming up from UCLA and Children's LA, so we really are able to offer the top flight care at that academic family medicine center. So
Yes.
I'm very proud.
So
Well,
am I.
then as we look at healthcare throughout the county, I had started a clinic in Thousand Oaks. It was taken over by someone else because there's only so many places I can be. But where else do we have access to care? Where else can, when a patient is discharged from the hospital, can they receive care and stay out of the hospital, get health care?
Well, we have them in every city in the county, from Piru to Simi Valley, Oxnard, Ventura. We have we cover every city in the county.
So Camarillo,
Camarillo,
Oxnard, Los
yes.
Islas, Magnolia, Mandalay Bay, Caneo,
Yes.
Moore Park, Sierra Vista and Simi, Fillmore,
You've been
Santa
there.
Paula, Ventura. I know all those people, and everybody who runs those clinics, they're interested in providing health care. And so we meet once a month, and it's a joyous moment because everyone there is looking to what can we do? How can we get something from you or from the healthcare agency to help us out? And we have a partnership there.
Yes, we do.
So one of the we've looked at diabetes, we've looked at obesity, we've had CDC community transformation grants. So I know you have a grant that's
Yes, we're very
been-
proud of it.
been submitted and
It was submitted over a year ago, and we thought we submitted it, and we didn't hear back for a while, but we were supposed to hear back last October, and we heard back in January. So the grant we actually applied for was through the Center for Medicare and Medicaid Services, CMS grant. It's an innovations grant, and what they had asked the nation, different entities, is to come up with an innovative treatment plan to go along with an innovative payment model. So there were 4 categories, and we fit into the category of population health, where we decided to submit a grant surrounding the COPD issues that Ventura County faces. And we would like to treat our patients, Ventura County patients, not just Ventura County Medical Center, but Ventura County patients with COPD better. We want to treat them better.
so COPD. What is COPD? How should I start screening for that?
Well, the grant actually calls how we designed it was to there's a gold standard of treatment for COPD, and that's the GOLD guidelines. And what we did was we wrote the grant surrounding those guidelines and enlisting the county primary care physicians in our network to be involved and to follow those guidelines and treating the patients following that guideline, as well as other opportunities that the grant is offering, and then also to receive incentive payment in doing so that the grant is modeled after.
Well, the GOLD guidelines, that's global obstructive lung disease. That's not just us. Throughout the world, we have to worry in Africa, Asia, China, Japan, everywhere that R.J. Reynolds has been, we have to worry. The cigarette smoking is a real problem. And so for someone over the age of 50 who's been smoking for more than 10 years is at risk. And we hope really to be providing more services. And when you say county physicians, that's not just associated with Ventura County Healthcare Agency. These are physicians in private practice, so we can get everybody up to speed and make sure that everyone's getting the right access to care. In cystic fibrosis, which is what we take care of, up on the third floor there. Dr. Bruce Marshall said, if we just had the patients do everything that we know works, everyone would live 10 years longer. We don't have to spend money on fancy cures, just do what works. And so now we have a registry, but we're followed every year and compared to every other CF clinic throughout the United States. And on some things I'm very proud, others I go, how in the world do they get these patients to do all the things that they need to do?
Yes, this particular patient population has challenges. It's a very challenging population. But we do know that in Ventura County there's over 28,000 cases of COPD, and only about half of those cases actually know that they have it. So we're targeting about 1,500, 2,000 patients that we're trying to reach over the course of 3 years, and then newly diagnose some that haven't been diagnosed yet. So we have multiple community partners that we're going to be enlisting their help as well, so we can get out there and do some outreach, education, and find these patients. And then also the patients that visit us in the hospital, we want to do, you were talking about case management. So of course the grant calls for case managers to be hired, and that can go out in the field and see these patients in their home. And then also see them in the hospital when they come in, provide that warm handoff to home, and have that patient followed under various tactics, such as the care messaging. One of your previous guests spoke of.
We have the Area Agency on Aging, and really looking for a 211 number, because once you have an aging parent, trying to get through the maze of services and things that you need to do is pretty tough. So we're working on a 211 number for developmental screening through a program called Help Me Grow. So having that ability, but we have a lot of different agencies in our county. I think probably the biggest part of chronic obstructive pulmonary disease is stopping smoking. Who are your partners to help stop smoking?
Well, we have the American Lung Association, which offers programs and support groups, and then we also have our own public health department with their program, Call It Quits program, which we can implement as well.
So 1-800-NO-BUTTS, B-U-T-T-S, by the way, that'll get you, pay for that. It's 50 cents a pack. These people have spider webs growing on them. Give them a call. Stop smoking. Sorry.
And the 1-800-NO-BUTTS, they also offer incentive $20 gift card for Medi-Cal patients if they just make the one phone call.
And medication. So we really start off. Stopping smoking's not easy, and
No.
so gee, what could I do for 15 minutes a day? Well, I can inhale a chemical that makes my heartbeat stronger and makes my brain work better and relaxes the muscles of my back and causes heart disease and lung disease and cancer. I don't see a cow walking into a burning barn with that in mind. So. But the nicotine is as difficult to get off of as heroin. The recidivism is terrible.
The public health department on their program, that they have seen a 30% success rate, which is a good thing. So we went a little bit lower than that when we wrote our grant. I think we were hoping for a 25% success rate with that. Yeah, so we'll see. Most
programs are 3%. So in terms of heroin addicts giving it up, 3%. Cigarette smokers giving up 3%. So anything that...
They have a very robust program at public health. So.
And then in terms of reaching out to the community, we now have 9 case managers for my pediatric clinic. And so this is a whole new area for management. It's not just seeing your friendly neighborhood doctor who has all of 1.5 minutes to talk to you, I guess, nowadays.
Right. We were hoping to implement the program outside the typical clinical setting. We want to do the bulk of the grant and the the instruction surrounding that, or the treatment at the home, at the patient's home, outside the clinical setting.
So there'll be a horse and buggy outside, and the doctor will go in with his
Yes,
with his
we're
bag.
getting back to house calls.
Yeah, so
Case management for the
case
nurse.
management and community health workers.
Yes.
Now, are you partnering with visiting nurses?
Yes, we're going to be partnering with Livingston and possibly a few other agencies that can help us provide some case management to these patients. There's going to be a lot of patients, and we'll need that support, that help.
Well, from what I've seen, it was probably a year or two ago, we had 550 patients with COPD, and 170 of them ended up back in the hospital over and over and over, where that's a very expensive place to provide care. So as I remember, with these innovations grants, you have to say, here's where the savings comes from. So how are you going to prevent those hospitalizations or discharge them better? It sounds like you
Yes, well, we do have a program that we started already called the Transitions Program. And what we do is when a patient comes into the hospital, the inpatient list is reviewed by case managers. And if the patient is unable to be seen in a timely manner when they get discharged, upon discharge, then they are referred to that clinic. And the case manager from that clinic sees them, and the patient is seen in Transitions Clinic in a timely manner as the time the physician indicates to help prevent that. And it has shown success since that inception.
I remember, I think my favorite of all time was in Phoenix, Arizona, where a man with kidney disease, homeless, had basically run up $6 million worth of hospital bills, and by the city investing $60,000 in a case manager and a place to live and so forth, they basically walked away with a pretty big saving. So how are you going to keep track of those savings? Is that, because I'm sure for your grant you're going to have to say, oh, this is what it cost us last year, and do we have an electronic healthcare record that's going to be helpful for that?
Yes, we do. As you know, we went live with our Cerner electronic health record, and it has the capability to help us to keep track of those types of things.
And probably the hardest part is we want to get that information in and know what to look for. And I think our respiratory therapy department has been working on just how to, it's just ones and zeros in there, and trying to turn those computer bits into information that we can use. Has the respiratory therapy program been working on that along with the hospital physicians?
Yes, they have. They have been working on it. We meet regularly to try to develop the correct workflow for such things.
Yeah,
and you will be invited to our next meeting with our physicians to discuss the data.
I think workflow is important too, because for our physicians, give me a computer that only doubles my work and I'll be happy. So it's certainly been a struggle to not pay attention to the screen and actually be able to care for patients, which is what we do best. We do that much. I have biblical typing there: "Seek and ye shall find." And I think I have a nurse case manager whose typing is more legible than mine is. So it's a difficult thing sometimes.
It is. It is. You want to keep it personal with the patient, and you don't want to deviate from that by bringing in a laptop and staring at the screen. So you need to keep that in mind when you're seeing patients.
I think we have to find look at them in the context of where they're living and what their support system is. When I took our care message person over to Las Islas Clinic to let her see what happens at our Certified Diabetes Center of Excellence, where patients come from literally all over the counter, who's so hard, whose management is so difficult that they really require this extra team to get through. And the educational messages are there, but how to incorporate it into your lives is a very, very difficult thing. How about with the medications? They've changed some for COPD as well? So we've gotten away just from prednisone and antibiotics.
It's very complex now. There's, depending on the patient and the staging, really, there's so many different combinations that could be utilized. So it's a lot more complex than it used to be.
So we can just, if we can get to all those thin little smoker guys, some decent nutrition, those chubby smoker guys, a little more exercise, get their medication properly handled, access to primary care, early discharge. They can't, with respiratory infections, that's certainly going to set people off. We worry about our enterovirus right now for kids. Everybody's in a panic, but I need my immunizations too. So the resurgence of measles, the resurgence of pertussis, and people thinking they're protected as long as everybody else gets immunized. We have to make it through that too. Do people have access to immunizations then, to flu shots?
Oh yes, they do. We have on our website, people can go to our website and see where the clinics are.
Yeah, so where they are, and then the other.
They're all over the county.
Yes, they are. So
free clinics.
And then in terms of physician education, is there a physician who's going to be really working on an educational program? Because when I look back at COPD, I see them see the patients for allergies and immunology problems and how that interacts with their COPD for Dr. Bajwa.
Yes. Dr. Bajwa will be the doctor that will be educating the primary care physicians on the GOLD guidelines, and as well as the nurse case managers will be providing education for the patients.
Thank you, Dr. Higgins. We're really proud of what you're doing in terms of this Innovations Grant and what it means for the County of Ventura and the health of our patients. Well, Ventura, we are also building a replacement wing to our hospital. I'm so proud. There's, well, what you're about to see is a fly-through video of our hospital in 2017. Roll video, get moving, Ventura. All right, Ventura. Well, you've seen a hospital replacement wing. You've seen a really dedication to healthcare. With this new grant, we'll be able to really screen and help people who've been smoking, who have chronic obstructive pulmonary disease. So, Ventura, stop smoking. Come by to our new hospital because we are in Ventura and we got moving.